nose, throat, and head and neck, ENT-HN, for 8th semester students of the Faculty of Medicine. Ear, nose, throat, and head and neck, ENT-HN, the study of ear, nose, throat, and head and neck, ENT-HN, in semester 8 is a part of the medical curriculum that focuses on diseases and disorders of the organs around the head and neck, including the ears, nose, throat, and related structures. In this semester, students are expected to understand the anatomy, physiology, as well as how to diagnose and treat disorders or diseases occurring in these areas. 1. Definition of ENT-HN. ENT-HN is a branch of medicine that focuses on the diagnosis, treatment, and prevention of diseases affecting the ears, nose, throat, and other structures of the head and neck, including the thyroid glands, upper respiratory tract, and related organs. ENT specialists are called otolaryngologists, and they treat health issues related to hearing, breathing, and communication functions. 2. Learning objectives of ENT-HN in semester 8. In semester 8, medical students learn about ENT-HN with the following objectives: to understand the anatomy, physiology, and pathology of the ENT and head and neck systems, to master thorough physical examination techniques of the ear, nose, throat, and head and neck, to identify abnormalities and disorders in these organs and make accurate diagnoses, to study various medical and surgical therapies used to manage ENT-HN disorders, to understand the importance of prevention and management of common ENT-HN diseases. 3. Scope of ENT-HN. 3.1. Ear disorders: acute otitis media, infection of the middle ear causing inflammation, ear pain, and temporary hearing loss. Causes: bacterial or viral infections affecting the middle ear, commonly occurring in children. Treatment: antibiotics for bacterial infections, analgesics for pain relief, and decongestants to reduce swelling. Outer ear disorders, such as otitis externa, inflammation of the ear canal. Causes: bacterial or fungal infections, often due to moisture or the use of foreign objects like cotton swabs. Treatment: topical antibiotics or antifungals and proper ear hygiene. Hearing disorders: conductive hearing loss, caused by problems in the outer or middle ear, such as earwax buildup or middle ear infections. Sensory neural hearing loss, caused by damage to the inner ear, cochlea, or auditory nerve, often due to age, loud noise exposure, or genetic factors. 3.2. Nose disorders: allergic rhinitis, inflammation of the nasal mucosa triggered by an allergic reaction to allergens such as dust or pollen. Symptoms: nasal congestion, sneezing, itching, and clear nasal discharge. Treatment: antihistamines, decongestants, and nasal corticosteroids. Sinusitis. Inflammation of the sinuses, often caused by viral or bacterial infections. Symptoms: facial pain, nasal congestion, cough, and fever. Treatment: antibiotics if bacterial, decongestants, and analgesics. 3.3. Throat disorders. Pharyngitis, inflammation of the throat causing sore throat, difficulty swallowing, and fever. Causes: viral or bacterial infections, such as streptococcus, bacterial throat infection. Treatment: antibiotics for streptococcal pharyngitis, pain relief medications, and antiseptic gargles. Laryngitis, inflammation of the larynx causing hoarseness or voice loss. Causes: viral infections, irritation from excessive voice use or smoke exposure. Treatment: voice rest, adequate hydration, and anti-inflammatory medications. Dysphagia, difficulty swallowing, difficulty in swallowing food or liquids, caused by problems with the throat muscles or nerve disorders. Treatment: physical therapy for improving swallowing function or surgery if necessary. 3.4. Head and neck disorders. Head and neck cancer. Cancers that can occur in areas of the head and neck, including the mouth, throat, larynx, or thyroid glands. Symptoms: lumps or ulcers in the head and neck region that don't heal, hoarseness, difficulty swallowing, or weight loss. Treatment: treatment depends on the type and stage of cancer, including surgery, radiation, and chemotherapy. Thyroid gland disorders. Disorders of the thyroid gland can lead to hypothyroidism or hyperthyroidism. Symptoms: weight loss, tremors, hyperthyroidism, fatigue, weight gain, hypothyroidism. Treatment: medications to balance thyroid hormone levels or surgery if thyroid enlargement occurs. 4. Learning components. Theory. Lectures on the anatomy and physiology of the ENT-HN system. Case studies to understand various medical conditions of the ENT-HN system and their management. Discussion on medical and surgical therapies related to ENT-HN diseases. Practical. Physical examination of the ear, nose, and throat using tools like otoscopes, nasal and throat endoscopy, and hearing tests. Management of ENT-HN cases through simulation and clinical observation. 5. Assessment of learning. Theory exams, assessing students' understanding of diseases and disorders of the ENT-HN system, as well as the diagnosis and treatment approaches. Practical exams. Testing students' ability to perform accurate physical examinations for ENT-HN disorders and plan appropriate therapies. Case discussions. Students will discuss medical cases related to ENT-HN and plan treatment strategies. By studying ENT-HN in Semester 8, Medical students are expected to understand and manage common diseases occurring in these organs, as well as develop the skills necessary to diagnose and treat patients.